Dr. Christopher Thompson. I'm the Director of Therapeutic Endoscopy and run the Developmental Endoscopy Lab at Brigham and Women's Hospital, Boston, Massachusetts. I'm also an Associate Professor at Harvard Medical School. I'd like to talk to you about a recent publication we have in endoscopy titled Development and Initial Validation of an Endoscopic Part-Task Training Box. The aim of this study was to develop a part-task training box that could assess skill level for both trainees and potentially practicing clinicians. The intention was also to have a box that could be used to develop skills. There's currently no objective and validated means of assessing trainee progress or to determine when a trainee is comfortable enough with endoscopic equipment to proceed to clinical cases or is potentially ready to graduate and perform cases on their own. Before we could develop the training box simulator, we first had to determine what fundamental endoscopic skills were. And we did this via three mechanisms. First, we did kinematic analysis to break down the core skills. And how we did this was that we fitted master endoscopists and novice endoscopists with electromagnetic sensors so that we could record all of their movements during endoscopic procedures. We then analyzed the data and looked for the biggest discrepancies. And this was very helpful in determining certain maneuvers that experts did very well, but novices did not do well at all. And those ended up becoming some of the fundamental skills in our box. We also did literature review and relied on an expert panel to help come up with our final list of fundamental endoscopic skills that the simulator was then built around. Several simulator prototypes were rapidly developed and modified numerous times. These simulators were built in conjunction with a scoring system, which was then validated. In the final iteration of the box, there are 5 modules, each focusing on a different core skill. These core skills include retroflexion, torque, knob control, the ability to navigate and perform loop reduction, as well as polypectomy. In the final scoring system, there's 5 minutes permitted per module, and a certain number of tasks has to be performed within that 5-minute period. If there's time left over, extra points are awarded for that time that's left over. And this allows very precise scoring. So at the end of a 25-minute period, we'll have a number that correlates to roughly how well that trainee performed. We then pursued a rigorous validation process which demonstrated evidence for validity regarding content, internal structure, and response process. We hope that this training box simulator is a useful tool for trainees to develop endoscopic skills, as well as a good means of assessing their skill in the future. We think that further study is needed, including a multi-center study, which can potentially correlate box score with clinical endoscopic performance. I hope you enjoy the article.